Hi, I'm Dr. Saurabh Welling and welcome to Dr. Welling's Health Show. Our homeopathic specialist clinics have been seeing a lot of visits for the treatment of depression. To overcome depression, first we need to know few facts about depression. Depression is a medical condition and not just laziness or a temporary response to normal grief or some discouragement. A major depressive episode is called when you experience every day or most of the days for 2 weeks or more 5 of these symptoms which I am going to discuss now, like depressed or irritable mood, sleep problems like sleeping too much or too little, or probably sleeping all day, change in interest or low motivation, excessive guilt or low self-image, significantly low energy, and change in your self-care pattern like not showering, not able to concentrate, changes in eating habits, agitation or severe anxiety and panic attacks, and lastly suicidal thoughts, plans or behavior which includes self-harm. Now it's important to remember that not everyone who is depressed is suicidal. You can still seek help even if you haven't demonstrated any specific suicidal or self-help behavior. Or even if your symptoms are not as severe or persistent as the symptoms I have already told you. Clinical depression is very common illness. While we don't know exactly what causes depression, a number of things are often linked to its development. Depression usually results from a combination of recent events and other long-term or personal factors rather than one immediate issue or event. Some research suggests that continuing difficulties, long-term unemployment, living in an abusive or uncaring relationship, long-term isolation or loneliness, prolonged work stress are more likely to cause depression than recent life stress. However, recent events such as losing a job suddenly or a combination of events can trigger depression. So if you are already at risk because of previous bad experiences or personal factors, depression can run in families and some people will be at an increased genetic risk. However, having a parent or close relative with depression doesn't mean you will automatically have the same experience. Now, life circumstances and other personal factors are still likely to have an important influence. Some people more at risk of depression because of their personality, particularly if they have a tendency to worry a lot, have a very low self-esteem, even perfectionism, are sensitive to personal criticism, or are self-critical and negative. The stress and worry of coping with a serious illness can also lead to depression, especially if you are dealing with long-term illness or chronic pain. Drug and alcohol use can both lead to and result from depression also. Many people with depression also have drug and alcohol problems. So although there has been a lot of research in this complex area, there is still much that we doctors don't know. Depression is not simply the result of some chemical imbalance. For example, because probably you have too much or not enough of particular brain chemical. It's complicated and there are multiple causes of major depression. Factors such as genetic vulnerability, severe life stressors, substances you may take, some medications or drugs and alcohol, and medical problems can affect the way your brain regulates your mood. So if you experience 2 or more of these problems at the same time, it could increase your chances of triggering the depression. It's important to be aware of what causes this condition, especially if you feel you're prone to depression because of genetics, a trauma in your past, or something else. Now that you know the symptoms of depression, some positive coping skills can help you. All of these techniques are supported by scientific research and doctors like psychiatrists, and these skills are frequently recommended as an important part of treatment even for patients who continuously are on antidepressant medications. But do remember, do not stop these prescribed antidepressant medications without first talking to your doctor or to our homeopathic consultants. So discuss any question or concern about the side effects of your medications with your doctor. The key to self-treatment for depression is to be open, accepting, and loving towards your own self first and what you are going through. Suppressing your feelings and emotions may seem like a strategic way to cope with the negative symptoms that you are facing. But this technique is ultimately unhealthy. If you are having a very down day, let's have yourself feel that emotions, but don't stay there. Consider writing or journaling your thoughts, what you are experiencing. Then when the feelings lift, write about that too. Don't wait for yourself to be in that mood to write more. For example, give yourself permission for 30 minutes or a vacation, or schedule a healthy hobby every day. Just remember to do these activities with the right attitude. Doing moderate exercise about 5 times a week at least, minimum 20 to 30 minutes, can dramatically help you lift your mood. Also pay attention to how or what type of food or drink you are eating that is influencing your mood. You don't have to be on fat diets, but everyone will be depressed if they frequently binge on carbohydrate, junk food and energy drinks. Remember the virtue of moderation in eating. Focus on people who lift up you. Interact frequently with others that bring your mood up, not people that brings you down. However, it's okay for some time to dedicate to yourself. Find a balance, but don't isolate yourself or the depression will linger. Sleep regularly. Try to keep a regular sleep schedule. Keep a balance with not too little or not too much sleep. Staying up late one night and then sleeping excessively the next day is a sure way to feed and increase the depression. Also, don't try to solve problem late at night if your brain is already half tired or half asleep. As you practice these coping skills, know that you are on the path to recovery and to overcome that depression. When you are depressed, you may feel like you can't complete anything. That makes you feel worse about yourself. To push back, set daily goals for yourself. Start on very small goals. Make your goals something that you can succeed easily in first goal. As you start to feel better, you can add more challenging daily goals. Depression can tempt you to isolate yourself and withdraw from your friends and family. But face-to-face time can help you wash away your tendencies of depression. If you're unable to spend time together in person, phone calls, video chats can be very helpful. Try to remind yourself these people care about you. Resist the temptation to feel like you are a burden. You need the interaction. Most modern antidepressants have an effect on your brain's chemical transmitters, that is serotonin and noradrenaline, which relay messages between brain cells. This is thought to be how the medications for depression work for more severe depression. Psychological treatment can help you to regulate your moods. So effective treatment can stimulate the growth of new nerve cells in circuits that regulate your mood, which is thought to play a critical part in recovering from the most severe episodes of depression. Happy music plays an important role in elevating depression, especially those based on pleasant ragas. To know more on this or to get custom-made treatment program for depression, which includes homeopathic medicines, specific yogas, music, meet our homeopathic specialist personally. Also remember, everyone's different and it's often a combination of factors that can contribute to developing depression. It's important to remember that you can't always identify the cause of depression and change difficult circumstances very easily. So, the most important thing is to recognize the signs and symptoms and seek help and support from my team of specialists or contact me directly. That's all in today's episode on depression. Subscribe to stay connected with me and watch my video as we release them. Bye and take care.